Good afternoon, everybody. Well, welcome to our webinar this afternoon on the joint draft carers strategy. My name's Helen Yates and I'm from Nottinghamshire Carers Association, and we've been involved in the creation of the strategy, along with lots of people we're going to hear from in the next hour this afternoon. We'd like you to please keep your microphones on mute and your cameras off, if at all possible, please, to make it easier for everyone else to hear and see what's happening on the call today. If you have any questions at any point you'd like to raise with the group, then please pop them into the chat and there will be an opportunity for Q&A later on during the hour. All the speakers will introduce themselves as we go through, rather than me telling you who's going to be at the moment. And at the very end, there will be an email address shared with you all. So if you have any further questions or queries about anything discussed this afternoon, feel free to make contact via that email address. We also have our BSL interpreter with us this afternoon, Liz Murray. If anybody would like to see the BSL interpreter prominently on your screen, if you could indicate using the virtual hands up signal now, then Liz will be able to pin your screen so that you'll be able to see her when other people are talking. Liz, we have a hand up from Rebecca's iPad. It's just come up. You can see that. That's great, thank you. Anyone else wanting to see the BSL interpreter as a pinned screen, please just let us know and we'll make sure that that happens. Okay, so welcome everybody. I'm going to hand over now to Dan Godley from Nottinghamshire County Council, and he is going to start us off with an overview of the strategy work that we've been completing. Thank you.
Thank you, Helen. Thank you, James. Hopefully you can see the presentation on screen. So as Helen said, I'm Dan Godley. I'm Lead Commissioner for Carers for Nottinghamshire County Council. And I'm going to go through the first slide, and I'm going to pass to colleagues from Nottingham City Council and the Clinical Commissioning Group, who will also do a little talk around a couple of slides that are coming. And then some carers will talk to us about their involvement with developing the strategy. So in terms of the overview, so James, if you can just pop the next slide. So in terms of the overview of the strategy, so basically the strategy is a plan, and this is our plan that we've put together for the next 5 years in terms of supporting carers. And for the first time, this is an actual joint strategy that is actually covering Nottinghamshire County, Nottingham City, the clinical commissioning groups, which is basically those organisations that are responsible for primary care services, so GP practices, district nurses, social prescribers, etc. And the ICS, which is the integrated care system, which is overseeing the whole of the health and social care system across Nottinghamshire and Nottingham City. So it's the first time we've done this, so it's across the whole piece, really. Okay. In terms of how the strategy has been produced, this has been fully co-produced with carers. So we'll talk about that a little bit later, because obviously we've got some carers that's going to talk to us about their experience of developing the strategy. But this is a first for us, you know, this has been a really great piece of work, and I'm sure the carers will tell you more about that a little bit later. It is an all-age strategy. So we wanted to ensure we cover all aspects of unpaid carers, including young carers, parent carers, so that's carers of disabled or children with other health or health conditions, and of course, young carers of older people. Young carers and carers of older people, which obviously makes up quite a big proportion of the number of carers that are out there. We do have an easy read version available of the strategy document, and we'll show you where to access that a little bit later if you've not already seen that or had the link to the strategy and the consultation questions. So that's basically just to give you a very quick overview of what the strategy is and how it's been produced, who's produced it, and what sort of range it covers. There will be opportunities to ask questions a little bit later as well. So I'm now going to pass you over to my colleague Lucy Galley, who will go through the vision of the strategy. So Lucy.
Hi, so yes, I'm Lucy Galley. I'm Strategic Programmes Project Manager for Nottingham and Nottinghamshire Clinical Commissioning Groups. The strategy vision that you can see on this slide was actually written by the members of the Carers panel, and it states that our vision is to support and work in true and active partnership with carers and their families for them to achieve healthy, balanced lives, to give them the confidence that they will be supported in a fair, respected and honest way by all of the agencies that they come into contact with. Next slide, please, James. I'm going to now hand over to Lisa.
Hi, so I'm Lisa Lopez, my pronouns are she and her. I'm Lead Commissioning Officer at Nottingham City Council with the Strategic Lead for Carers, and I'm also a carer. So as Dan said, this strategy has been co-produced with carers across the city and county. Carers have told us what they think the key principles of the strategy should be, so what we want to achieve and how we should work. So key to these are getting the right support to carers at the right time, tailoring support to individuals, joined up working, making sure carers are heard and no one is isolated. Could I have the next slide, please? So carers have worked with us on every aspect of the strategy, and the top 5 key themes have been identified from engagement work with a wide range of carers from diverse groups. Most of these themes aren't new, but they are key and they are what carers want to focus on. So those things are the right support for the person they care for, information, advice and guidance, access to breaks, support for the carer and the carer being listened to, and good communication. Could I have the next slide, please? So carers have developed key components, so what's most important to them in the strategy. Again, the key components aren't new, but they are important. I'm not going to read them all out, you can see them on the screen, but they include early identification, assessment and support, breaks from caring, information, advice, guidance and training, a whole family approach, and making sure carers have a voice. So for each of these components, carers have written I statements describing what they want to experience, and partner organisations have written we statements to state what we would do in response to that. So could I have the next slide, please? And I'm now handing back to Helen.
Lisa and Lucy and Dan for sharing that background information with you. James, if you could take the slides down, please. Thank you. So back in August last year, Nottinghamshire Carers Association were asked by the commissioning group that you've just heard from to support a group of carers to have discussions and to work on co-producing this strategy. And it's that group of carers, or some of them, who you're going to hear from. They're a group of carers who were representing a diverse range of different caring backgrounds, and they worked together over months and months to help come up with the draft strategy that you've seen and that was consulted on after today's session. So we're going to ask them some questions and they're going to speak to you. and I'll introduce them to you as we go through some of these questions so you can find out more about how they've been involved. So our first question is firstly going to Helen. Helen, do you want to introduce yourself to everybody?
Yeah, thanks, Helen. As you can maybe see from the screen, my name's Helen Torr. I'm actually a parent care of a young man who's 21 years old now. He has additional needs. I'm also a support worker at the Nottinghamshire Carers Hub. I've been passionate about supporting families with children who've got disabilities, well, ever since my son was born. And I've been through the SEND reforms, the SEN Code of Practice, and seen lots and lots of changes for our families. And for me, the opportunity to co-produce a strategy which is joint across both local authorities and with support from health is one I just couldn't shy away from. I was fortunate in the fact that I was working, with the Carers Hub, so I kind of got a heads up that this was going to happen, and I was cautious, positively cautious, that perhaps this could be the opportunity for parent carers to actually be acknowledged as carers. Very often, parent carers aren't seen in the same light as other carers, just mainly because they're caring for children. But of course, these children become adults, and the fact that we have a strategy that covers all age ranges means that there is going to be support there for these families to move from children's to adult services. It's really refreshing that all the hard work that us as carers has put in has been heard. I feel we've been included from the absolute beginning. We've had a well thought out process. It has taken some time, but everyone's views were considered. And even though we had disagreements at times, and I will say that ourselves as carers and some of the professionals have disagreed about things, but we have been listened to, and I'm very proud of the strategy that's as a result of this. And I'm sure the rest of the carers that are on today will really second that. Thanks, Helen.
Thank you, Helen. What did your involvement look like? What did you have to do?
Well, it felt like never-ending Zoom sessions, which is what we've all had to come to terms with. And I think it was a very effective way of doing it because, for the time constraints. But we really had to dig deep into what our lives were like as carers and look at the days that were difficult for us and what would make a difference, and what's a reasonable thing to want to help make that difference, and to also understand the restraints that local authorities are under as well. They obviously have budgetary constraints, they have resource constraints, but I thought it was really important for them to hear what our problems were, and through lots and lots of conversations, I do felt that came across. And I would say we were meeting every couple of weeks, but I felt our time was considered. It was they were organised to fit in with our lifetimes, our lifestyles, within our caring role, and all the hard work I feel has paid off. And I would highlight Nottingham and Nottinghamshire as a way forward for other local authorities to work with their carers.
Thank you, Helen. Kevin, are you with us?
Yes.
Hi, Kevin. Kevin,
Hi.
I ask you the same question. How do you feel you've been involved in creating this strategy?
I'm just trying to get me. Can you hear me?
Yes, we can hear you.
Oh, you can. I'm just trying to get me. Oh, hello, hi.
Hi.
The internet connection's been quite poor this morning. Hello, hi. Good afternoon, Ellen. Okay. So that question again. Sorry.
How have you been involved in creating the strategy?
I've been involved. Well, I've been creating it since August, since I was asked by yourself, Dan, and Sarah. Like Ellen's seconded it, or Ellen's done an excellent introduction on it there. I will say that. So, but yes, been involved in it through all the aspects, right from the start to the finish. and it's been excellent. And like Helen said, we've been involved in it at very good times as well.
Lovely, thank
Yeah,
you.
excellent.
I'm going to come to Pam next.
Hiya.
Ready? Hiya, Pam. So Pam, the next question is, how involved did you feel?
Well, like Helen, I'm a parent carer primarily currently, but also I've been experience of looking after an elder daughter who's got mental health issues, and my dad previously, who's sadly died now, but he had Alzheimer's. So I've got several hats on when I came to the table, if you see what I mean. And I was a little bit dubious, shall we say, of coming along and thinking, oh no, are we going to get, lip service really? Because I didn't really understand what co-production was. I was hoping it meant what I was hoping it meant, that we would be involved in every aspect. But we've been used to promises before of engagement, and we'd had sessions, where it's consultation, where you can decide on plan A or plan B that's already been pre-decided for you. And that is not co-production. And thankfully, that's not what we experienced. We were involved right from the very beginning, right from day one, or so it felt, right from day one, in deciding where this was going, how it was going to look like. And that made us feel an awful lot better, because like Helen said, there were disagreements, because it's about expressing opinions, it's about sharing experiences, and our experiences could be foreign to some of the teams that we worked with, because they weren't carers.
Yes.
So they didn't understand where we were coming from, but they were actually very willing to listen, and that meant that they were very willing to adapt things. So where we didn't agree, we were able to discuss those things, and they made changes, but they were also able to explain things where they couldn't make changes, for example, with different laws and things. So we ended up, it felt like a complete teamwork. There was no differences. We weren't sidelined. We weren't brought in just to, pay some lip service, or we've consulted carers. No, definitely not on this. We were definitely involved in all aspects, and I'm really pleased with how the strategy's come about. Really proud of it.
Thank you, Pam. Helen, have you got anything to add to how involved you felt?
Yeah, I certainly agree with what Pam said about in the past being given the fait accompli, as it were. So here we've designed this strategy or this service. Can you just approve it so we can tick the box that you've been consulted? And that is not participation. That's not co-production whatsoever. Co-production means doing it alongside each other from the very beginning. And for me, it's refreshing, because many a time carers, service users are given the service and it's not fit for purpose, because it doesn't affect what affects their lives. But this has gone right from the beginning, listening to what we're saying.
We've also tried to get as many different types of carers involved as well, so that it covers lots of experiences, because it's been difficult trying to get lots of different representatives on board, but we've done our best. It's been much more difficult, obviously, getting young carers. We haven't succeeded that way. but you know, that's a different challenge. But originally it was supposed to be a strategy for carers of those above 18. And when we pointed out really that was excluding parent carers, you know, that was delineating, you know, the fact that parent carers cared for children and therefore came under a different act under the law. That shouldn't make any difference. We were still carers. And actually, they listened so much that we're included. It's for all carers of all ages. So young carers are included in this strategy now. Parent carers are included.
Oh, sorry, Julie.
So this is a strategy for all carers, not just carers of adults anymore. And that's what we're proud of. That we hope we've got it right. It'll go out for consultation now. We hope we've got it right. We'll wait to see. We hope it'll affect changes and the services going forward.
I think it's worth pointing out that actually it does say in the Children and Families Act that, and it does say in the strategy that we are, you know, parent carers are carers. And from my experience working as a support worker at the Carers Hub, I think we were considered just to support those people who were caring for elderly relatives or you know, adults, but we support any carers. And I think that's something we have to acknowledge, is that if you're caring for someone else, be it a neighbour, a friend, a relative, a child, you are a carer. You are invisible almost to most people, because you may claim carers allowance, you may not, but you're invisible. And through this strategy and through the support networks that were available in the city and the county, I think it's about time that carers were acknowledged for the work that they do, and you know, the important part that they are in society, particularly in Nottinghamshire and Nottingham City. I think that's been acknowledged.
Thank you, Helen. I'm going to come to David next, who's another one of our carers from the co-production group. David, one part of this strategy that people will see when they read it is the I statements. Would you be able to share with everybody what the I statements are, how we got to them, and how they were put together?
Yeah, firstly, just like to say, I'm David, obviously, and I was asked to join the carer support group by the support group that I belong to, which is HETIS, which supports families with alcohol and substance abuse. So it's entirely aimed at the families. So I probably bring a slightly different dimension to the other carers because my experiences have been different. But I think the value of the I statements and the time that was spent discussing these, you know, it was all very adult discussion. We all had separate needs and wanted to get them over, but I think we arrived at what we all consider to be a very, very good consensus as to what our main priorities were and how things needed to change, with those I statements being at the forefront of the thinking of the people who are going to make that change. We spent a lot of time on it. Probably the I statements, I guess, took a lot, you know, the majority of the time, because we felt that these were so important that they, you know, we wanted to get it right and get our message over. I've been very impressed. I came to the group slightly skeptical because, like, you know, some people, I've had some good experiences and some not so good experiences with the agencies involved with supporting my wife, but it's certainly given me a greater insight, and it's changed my attitude and approach to dealing with them now, because I realise now that people, you know, working in the spheres that are supporting these people are genuine. They care, and that's very important. They acknowledge they're not just doing a job. I would also say that, you know, the inclusiveness of it, I was sceptical about that as well, because I think, as Helen said, I didn't want it just to be a talking shop, so somebody could tick a box to say they met the relevant part of the sort of guidance in the Act, but that's certainly not been the case. And with the I statements, for example, and in fact, all of the meetings that we've had, we've all been invited to join the strategy board meetings to see, how our thoughts were being received and interpreted, and we're able to contribute to all those strategy board meetings. It's been a very informal and worthwhile experience, as far as I'm concerned. I feel very pleased with where we got to, and quite proud to have been part of it.
Thank you, David. Pam, would you like to say anything about the I statements?
Yeah, just picking up on what David said, because we do all have different experiences, and we come, we bring our own baggage as it is, to the table. But we were able to dig beneath that and find the commonalities. We're all carers, and even though we care for people in different ways, there's common themes running through them. And so those I statements, we found that we had similar experiences, similar needs, and that's what we dug into to come up with those I statements. We wanted life to be more than just being a carer for our loved ones. Yes, of course, we wanted our loved ones to be looked after well, but we also deserved things in our own rights. We deserved to be, just to have some respite sometimes, even something as important, or what some people might not consider important, just to go and get a haircut, just to go and get a cup of coffee and have an hour to yourself, to keep you caring longer. Those things were vital. And that stress came out through all of the discussions that we had, and we were able to feed that through into those I statements, and they became pretty powerful. And I hope we've managed to do a good job for people, not just while they're caring, but also life after caring, life for working carers, life for young carers. So it covers all carers, not just carers of people with older relatives, as traditional.
Thank you, Pam. Okay, so our next question is, what do you hope this strategy will lead to next? I'm going to go to Kevin first, if Kevin is able to be with us.
Yeah, hi.
Hiya, Kevin. So what do you hope this will lead to now? So we've got the strategy. What do you hope is going to happen?
Well, first of all, I hope it's going to be a day or two, because like I say, this is a long-term 5-year co-produced plan with county council and with the carers. So yes, I just hope it's going to be a day or two. I don't know if you're going to go more onto using the websites more and going online more. I don't know if you're going to, if that's what you're looking at doing on the long-term plan. If it's followed, that'd be absolutely fantastic.
Lovely, thank you, Kevin. And I'm going to take that question to Lisa from City Council now as well. So Lisa, what do you hope it's going to lead to?
Okay. So obviously I'm kind of here a bit with two hats on, because I'm involved in writing the strategy as a professional, but also as a working carer. So I really hope that carers will actually feel acknowledged and listened to. And I hope that they feel that we're taking notice of the role they play in keeping society going, and that as organisations we really want to support the carers in the ways that they need as individuals, because everyone's needs are different. I also hope that with the strategy and with getting this kind of all this joint working and having the different organisations involved, I really hope that everyone can start to think about how they can help carers. I think as organisations, we need to start to consider that anyone we come into contact might have a carer or might be a carer. We need to think about how we can make it easier for carers who contact us about the people they care for. So whenever we speak to somebody with a health condition or a disability or a social care need, that there might be a carer behind the scenes struggling to support them, or that they might be a carer themselves. We need to get used to asking questions like, do you have someone who helps you with ordinary tasks? Or is there someone who couldn't cope without you supporting them? We also need to think about the carers that we employ as organisations and how making ourselves a more flexible employer to work with carers and make ourselves more appealing to carers could improve staff retention and could solve some of our recruitment issues. During the height of the pandemic, I believe 1 in 4 adults had some form of caring responsibility. That's a lot of people. I really hope this strategy will help people to see that caring is everybody's business, not just a few organisations that would traditionally be involved.
Thank you, Lisa. Catherine, is Catherine Shotwell with us?
I'm here.
Hiya, Catherine.
Hi, Helen.
So Catherine is another one of our carers who's been working with us. Catherine, what do you hope this strategy will lead to now?
Well, I really concur with what's just been said. I think Lisa summed that up really well. But I think for some people, they don't even recognise they're a carer. So I'm hoping, and I think social care doesn't always recognise that they're a carer. So I'm really hoping that this enables a bigger conversation rather than a cursory, how are you? But, you know, tell me about your role, tell me how this impacts on you, tell me what you do, so that everybody can get a better picture of what the role of a carer is. Because I think, you know, as Pam's put very well, that it's varied for everybody, and it isn't one just standard answer. And I hope it makes people feel valued and that it's easier to access support. And I suppose, you know, I hope that all people involved in social care receive training on what the carer strategy is, so that they're aware to have that conversation and see what people really need. That's it.
Thank you, Catherine. Thank you very much. And I'm going to come to Sarah Wells now. So Sarah, what do you think of the strategy?
So, hi, I'm Sarah Wells. I'm a commissioning officer in Nottinghamshire County Council, and I work with a colleague, Dan Godley, who you've just met. I'm not currently a carer, but I was a carer for 20 years, and I expect fully in the future that I probably will be a carer again. So what my opinion of the strategy is, I think it's a good foundation, but I think we have to be honest, this is a start. This is a start for building relationships, for having good conversations with people we work with and with carers and with our colleagues and partners across wider Nottingham City and Nottinghamshire. It kind of builds on the relationships that we've got so far. But I think it's the start of a much wider conversation. So I kind of see this as something that hopefully we can grow and develop. It's been wonderful to hear about how people are proud of what we've achieved so far. And you know, I think all of us would hold our hands up and say, we certainly couldn't have done that without the help from yourselves or help from carers. It's fantastic to be part of something that everybody feels so invested in. I also think as well that this consultation makes the document stronger. It makes the strategy a living thing. If once we start to have conversations about it, we take those conversations into our communities, people feedback in their carer groups and support groups and other places they have conversations with carers. We start to breathe life into this and it becomes a living document, and then it forms, you know, and from that we can then start to have the conversations about what do we need to do next. So we've got the strategy, but what does this mean for people? What will it actually look like? How will things be different? And that's where I think the strength is, and that's what I'm hoping that we'll get from the strategy.
Thank you, Sarah. Pam, we'll come back to you.
Sorry, on mute again. I was just going to concur with what Sarah was saying. Really, this is a start, and it's not a magic panacea. It's not saying that we're going to have squillions of money thrown at things. We're not going to have magic services with a magic wand. What it's saying is that services that are out there that are going to be developed over this forthcoming 5 years will have this strategy at the heart of it, so that we will have that conversation. And the ethos will be that we will look at carers. So we'll look at the carers' needs. So things going forward, we'll have to consider how carers think about things, how carers would feel about things, what their life experiences are. So it's not about saying, oh, your life as a carer is going to be perfect going forward. I'm not here to delude anybody. It's the start of a conversation. It's the start of getting this strategy out there, getting services going in the right direction. And as Sarah said, it's the start of that conversation going forward. But it's putting carers where they need to be now, at the centre of those services, not on the peripheral.
Thank you, Pam. And we're going to bring that question to Stephanie Smith. Again, what's your opinion of the strategy? So that question. So Stephanie is another one of the carers, and she also works with Nottinghamshire Carers Association. So Stephanie, to you.
Hi, Helen. Yeah, I think it's absolutely brilliant. I think it's laid out really, really well. And what I'm really hopeful is that it builds on all the good work that's already been done, because obviously we've had some bad experiences as carers, but actually in the city and the county, there has been some really, really good work done for carers. But I think what the strategy will do is change the things that haven't worked so well. And I'm really confident about it because it puts carers at the heart of it. And I think that's been the difference from previous work. And it brings health and social care together. And I hope that they'll continue to work together with carers to make it fit for purpose.
Thank you very much, Stephanie. I want to say a massive thank you to Helen, Kevin, Pam, David, Lisa, Catherine, Sarah and Stephanie for speaking and answering those questions today, to let you know how they've been involved and their thoughts on what we've achieved to this point. We're going to open the floor now for questions from anybody who's on the call. If you want to put it in the chat, that's fine. I'll also be asking my colleague James to let us know if there's been anything in the chat to this point that we need to address. If your question is specific to somebody who's spoken, then obviously address it. You feel free to address it to them. If not, then we've got, as you know, quite a lot of people who've been involved here today who hopefully will be able to answer your question. So it's over to everybody on the call. If we have some hands up, that would be really helpful. Trevor, we'll go to you. Welcome.
Good afternoon, everybody, and thank you for inviting me. I've just got basically three main questions. It's about the strategy itself, as always in lots of strategies, the devil's in the detail. The whole family approach includes family and extended family, but there's no mention of friends. I'd like to see the word friends in respect to the whole family approach as part of the strategy, because that definition between family or a friend can be quite crucial, as you get like a next door neighbour looking after a person that wouldn't qualify under them because that word's missing out. I don't feel comfortable with that one. Secondly, is there any time frame for feedback for the city and county councils to the carers, family and friends after the strategy has been implemented? Feedback is crucial in so much as we all need to know if it's working. And third and finally, how do you, in the plan, find what support is available for both the patient and the care and the family and friends? Or how do you expect to find out what support is available after the implementation of the strategy? So those three main points. I'll put them in the chat as well, so it can't get forgotten.
Thank you, Trevor. Dan, Lisa, would either of you like to respond to any of those points?
So I'll just take myself on mute. Yes, thank you, Trevor, for the questions. So in terms of whole family approach, I mean, it will include all other members of their extended family or friends, absolutely. So although we're using that terminology, whole family approach, it's whoever matters to that particular setup in those circumstances. So if there is a neighbour or a friend, and as we know, we've got friends and neighbours and others, non-blood relatives that are crucial in support, then absolutely that they will be included in that wider, as part of that overarching whole family or the extended family and friends. So it is. I know it's a terminology we use, a whole family approach, but it is, whoever matters most to that in that particular dynamic for that particular circumstance. Trevor,
I was likening it to situations when if you got same-sex marriages and that type of thing that weren't recognised,
sure,
you go into hospital, you aren't even allowed to go in because you don't belong to the family, so you're not even considered as being allowed into the bed or whatever. I don't want a situation like that, simply because that wording is not there. It can cause a lot of problems because people only go by the rules. I'm a friend, and there's no mention of friend in the strategy. You've got to be a family member or an extended family. If the word friends was in there, then it would all put it to bed, quite honestly. In my view, I mean, it's just my opinion, basically.
Sure. And I think that's the thing around sort of the wider, the bigger picture in terms of how we provide services across the piece, and that's health and social care. So, I mean, I was having this conversation this morning around some of the aspects of the strategy isn't about the direct support available to carers. It's actually about how we operate as a whole organisation, because actually, if we don't get some of those things right in terms of access to support for the cared for, those conversations that we need to have, those things, like going to visit somebody in a hospital, whatever. If those things aren't right for people, that makes the carer's life much more difficult and more stressful. Absolutely. So and I think that's some of the things. It's much broader and outside. There's a wider issue and there's a wider picture, and as I say, we've got to work with our other services around certain aspects of that to ensure that we get other things right that then enables carers to have a better experience and less stressful situations when they're having to support the person that they're caring for.
Right. Less barriers, I agree.
Yeah, sure.
Exactly absolutely. That. Yeah, exactly that. And I think this is a consultation on the strategy. I think your concerns can certainly be heard, and I think from my point of view personally, there's no reason whatsoever why we couldn't include just in the strategy. This definition of whole family approach includes anybody who is important. It basically, say explicitly, this means the people around the carer, around the cared for, which could include young people, friends, neighbours, etc. To make that clear. I think just to come in on some of your other one of your other questions, in terms of the I'm just referring back to the chat. When you talk about the time frame for feeding back from the city and county councils, I think it's important to be clear. This is not a strategy from the city and county councils. This is a strategy from the city, county, CCG, healthcare providers. This is a whole system strategy, and that's what it's intended to be. So it won't be for us specifically as organisations just to feed back on it. What we intend to do with this strategy is, once we've had a consultation, I think this was going to be raised later, but once we've had the consultation and the strategy is finalised, our intention is that this would go to both the ICS board and the Health and Wellbeing board, which, as I'm sure you know, Trev, but just for other people who don't, are like cross-system boards that with many different organisations involved. And going to those boards with an action plan to get buy-in, get them to sign up to individual actions as organisations, and then for those boards to be responsible for monitoring people and holding the organisations to account on those boards. So that's what's going to happen, because it is much bigger than either of the local authorities.
But again, the bottom line is the feedback back to the people who got involved with the strategy. When it goes higher up and get to the ICS, it gets further away, so to speak. If there's a time frame or some kind of pathway that the feedback can be attained right through the system to the people that are working on the ground, so to speak, we don't want to lose that line of communication. Therefore, if there was a plan in place saying that there's a feedback, even from the ICS and the CCGs, I just said city and county because that's the home of everything else in my mind. But obviously, on the health side, there's the CCGs and the ICS. It's just that I just want a planned flow of information, so it's a feedback, right? You know, so we all know what's happening, where it's happening, and where it's not happening, in grey areas that we can all get on board with while it's up and running, basically, rather than sit back and wait for it to either be successful or maybe not as quite successful as you'd like it to be after the event. It's all working it during, basically.
Sure, and I think that action plan will include, you know, updates on what actions are taking place and how they're going. Can I ask, is there somewhere that you would like us to feed them back? Because while it's unlikely, we won't necessarily do another webinar like this to feed back. We would put the action plan in publicly available places so that people can see what the progress is. But is there somewhere, so they would be available online publicly. So is there somewhere that you would like it to be available?
Yes, I think I'm trying to remember the name. Tuvidia, the Carers Hub, basically.
So through the Carers Hub, it'll definitely be available through the Carers Hub.
That's heavily involved both city and county, and they have a huge reputation of doing great stuff for carers. Now, there's not many carers that don't know about it, and the ones that don't know need to be told about it. But yeah, feedback to that, and then that gives one point of contact for the feedback, and then as long as on a regular basis, that's what counts, basically.
Thank you, Trevor. Okay, thank you. We're going to move to Joe, but I'll also just say, if you have been putting questions into the chat, then they will all be taken, and we will put a question and answer document together following this session where the questions will be put to the board and they can respond. We're into just a very short couple of minutes now before we move on to the next part of this afternoon's session. So Joe, if you'd like to raise a question for us, that would be marvellous. Thank you. Hi.
Thank you. I think I've raised it in the chat, basically. It's the question that I'm really concerned about. And I know, and first and foremost, congratulations for this wonderful strategy. But one of the areas that I'm concerned about is the support for carers on an ongoing basis. And from my experience, the counselling provided by the Carers Fed has been quite useful to myself and lots of other people I've spoken to, but that's folding. It's in the process of folding. And I'm speaking to the chair, I've spoken to various other people, and they said, we don't have the money, we can't support it anymore. Now, when there's something that's running already, why is that being allowed to close? Especially because, in my opinion, 6 weeks for IAPS or the other sort of services is just not enough. And the mental health services are well stretched. So in the end, you have people who should be able to assist with the services, are also known as carers, now being burnt out and completely unhealthy. I mean, becoming unhealthy because they're not getting the support that's needed. So I wonder whether the strategy considers the need for something like the Carers Federation has been providing, maybe supporting them also. Other than that, I think one more point, and I think what Trevor was trying to say was that as the strategy goes up, basically, things might get modified. There should be some way of feeding back to the people who've co-produced this strategy so that we don't lose what wealth of information and experience has gone into the strategy in the policy framework level, basically.
Yeah. Okay. Thank you, Joe. Well, absolutely. The carers who you've heard from this afternoon are all remaining involved in the work as it's progressing forwards. So they will still be involved in hearing the outcomes of this consultation, any changes that then has on the strategy itself. and involved in then creating the action plans that have been referred to, but that will be explained to you further in just a couple of minutes. In terms of cuts to services and then where services fit, Lisa, do you want to come to that one?
Sure, Joe, I think I can handle that briefly, and I'm happy to talk to you in more detail outside of this if that's more appropriate. But just to say, it hasn't been cut. We didn't commission it in the first place. It wasn't a service that was funded or provided by either of our authorities. It's just been running. It's just been a charitable organisation running that service. So none of us have cut it. We haven't done anything to it. It was provided by a charity and they're no longer able to, and that's kind of all really. So through the Carers Hub, through 2V, which we do commission the Carers Hub, there are wellbeing support services available. There isn't an exclusive counselling service, but there is wellbeing support available, and the aim of that is to provide kind of coping mechanisms and coping strategies, and like coach all the carers in groups on how to do that to avoid the need for counselling. But yeah, so that's available through the Carers Hub, and it still is, and that certainly hasn't been cut. But yeah, just to make very clear, we haven't recently decommissioned the Carers Fed counselling service. It wasn't commissioned by any of us.
Sorry, Helen, I'll very quickly finish. My understanding was it started in 1998 and they were getting funding till 2008 and then it stopped, but I may be wrong.
Yeah.
Trevor might know more.
Okay, I do know more. I do know more. I can, and again, as I said, I can talk to you about it in more.
Yeah, okay.
This
That's
if
fine.
you want to. But yeah, 2008. So it hasn't been commissioned since then, but they've been running it since then. So yeah, 2008 is quite some time ago.
Thank you, Lisa. I can see that we have another hand up from Emma, but I do need to move on to the next part of the session. So Emma, if you do have another question, feel free to pop it into the chat, or there will be an email address at the end that you can contact as well. Thank you, Emma. I'm going to thank you to Joe and Trevor for your questions as well so far. I'm going to hand back over to Dan for the next part of this afternoon's session. And James, I think we need the slides back up as well. Thank you.
James. Okay, so the next couple of slides, I'm just going to talk to you briefly about the consultation survey and what's going to happen after the consultation is ended and what the next steps are. So the consultation survey, there is a short questionnaire for you to complete, and this is your opportunity to give your views of the strategy that we've obviously spoken about today. There is a copy of the strategy available when you do go into the online survey, which there's a link there at the bottom of the page. But it's quite a short survey. It's 11 questions. 8 of those are, so basically statements whether you agree or disagree. I mean, and obviously that ranges from strongly agree to strongly disagree. And there is obviously the opportunity for you to provide additional comments from your perspective. So under each question, there is, that the free text field in terms of you being able to, if you disagree with something that we've said, please tell us. But there is that opportunity at the end, the very last question or the very last box, to provide any other comments that you feel you need to tell us. In terms of support for completing the survey, the Carers Hub would be able to support carers if you call the Carers Hub and saying, can you help me complete the survey? Because the survey is online. We haven't written or sent out paper versions of the survey, of the consultation survey to people. However, we can provide a copy of a printed version of the strategy document should anybody request that or need a paper copy. And also the Notts County Council Customer Service Centre will also provide support if carers need support to complete the survey. The link's there on the bottom of the page, and it is open till the 16th of May. So a number of weeks away yet, but obviously we want your views. We also want the views of health and social care professional, education professionals. So when you go into the questions, it will ask you if you're a carer or a member of the public, or whether you're an actual professional, because we would like to see your health professionals and social care and education professionals views as well. So that will help us in terms of the analysis of the responses that we get. So James, can you move on to the next slide, please? Thank you. So once we've finished that consultation process, we will obviously analyse those results, which will take probably 3 or 4 weeks to do that. And the outcome of that will inform the next actions in terms of us developing that right support, or what other things that need to happen. So that will include us looking at the sort of commissioning new carer support services. So the recommissioning of the Carers Hub is one of those key services, and whether there is anything else we perhaps need to consider and think about. So that will inform our next steps in terms of that. We'll also develop how we will work together with our other key stakeholders in terms of how we can develop and support carers better. As I mentioned earlier, it isn't about direct support to carers. It's about how other organisations operate in terms of providing information and support to carers. Where there's a cared for that's been looked after in other services, and having that right level of information and communication, so carers and the families can make informed decisions, and obviously that is going to be an ongoing piece of work in terms of developing some of that. So as I've mentioned in the slide, there is going to be the creation of the action plans. A lot of that will be based on the 10 on the 10 I statements from the key components as well. So we will keep that sort of theme going, and we will then produce a final version of the strategy. So there'll be a final version of this, because obviously you see it's labelled as a draft, and we'll go to approval through our Adult Social Care Committee, and also the city's equivalent and corporate leadership team, as well as our CCG and ICS boards and Health and Wellbeing Board as well. So there's various levels of approval, but as I say, it's everybody's business, as Lisa mentioned earlier. And then we'll start to implement the plans from January 23. Please don't expect everything's going to be there ready from January 23, but we will start to make progress in terms of doing what we need to do, in terms of where we need to start to get to. And just picking back up on Trevor's point, well, how do we know that these things are working and this is the feedback? And as Sarah mentioned earlier, it's about us having those conversations across the board, with all our key stakeholders, but also still working very closely with carers, because the co-production doesn't stop. It carries on, and it'll take us a different form, but it will because actually now we're in a different phase, in a different part of the development now. So and the co-production will just run through it all the way through. So it doesn't stop after this bit. It carries on, and it needs to, to enable us and hold us to account that we are actually doing what we said we would do. Next, I think there's another slide, isn't there? I think, James. Yeah. So any further questions, please email us at that email address, and we will get back to you to respond to any further questions you may have. So that's me done. So back to you, Helen.
Thank you, Dan. Just a massive thank you to everybody who's been part of the discussion this afternoon, those who've contributed and shared the progress that we've made, and those of you who've come to hear what's been happening. Please share the consultation link wide and far, so that we can get as many people's views on as possible. That's the only way we're going to reflect what it needs in terms of any changes that the strategy needs. And as Dan said, there's the email address to contact. We will also make sure that the video and the slides are all uploaded onto various different platforms and websites over the coming days as well. So you'll be able to find them to watch this back or to go through the slides again. So again, thank you for your time this afternoon. Thank you everyone who's contributed, and take care.
Bye.
Thanks, everyone.
Thanks, bye.
Thank you, bye.
Bye-bye, everybody.
Thank you, Trevor.
Bye. Take care.
Thank you, Kevin.
Bye-bye,
Bye.
Kev.
Thank
Take
you.
care.
Bye.
Yeah, thanks all and well
Thanks,
done.
David.
Yeah.
Well done. Thank you.
Cheers,
Well
David.
done. I'll speak to you soon, Ellen. Okay.
Yes, thanks, Kev. Yeah.
No problem.
Thanks, Kev.
Thank you, Kev.
Enjoy Easter.
Yeah, and you.
Take care.
Bye. Bye. Bye.
Okay. Is Lisa's gone, hasn't she? I think.
Yeah.
Yeah. Yeah. Okay.
Okay, so I will stop recording.